Reconvene the Committee on Ed Reform. How we're going to do this is I'm going to read cards that were filled out for those who wish to speak and support the bill. If I'll read a name, if they have left, then I'll just go to the next name. And we're going to give 3 or 4 minutes for each one of you that wish to speak. Is there a Levi Pulver? Mandy Ortiz? Patricia Neuenschwander? Beth Gusche? It looks like G-U-S-H-E? No? Oh, all right. It would have been Betty Gusche. Here's last name Noble. Abigail? Oh, is that any relation? Oh. Right. I don't know. Alicia Stillman? She had to leave. Kate DeVries? Kate? It might be easier just say, who's here, but we have to read in the cards anyway, so. Thank you, Kate.
Yeah, thank you.
Push the red button.
Thank you. I appreciate the opportunity to speak today. As the founder of an advocacy group called the Cooperative for Safe Kids, we're focused on the health and safety of Michigan's children. And one of my priorities is to protect kids and ensure bright futures for them, whether they're vaccinated, unvaccinated, or unable to be vaccinated. Epidemiology is not my area of expertise, but to my reading, the evidence is clear that higher vaccination rates decrease the likelihood that one case of a vaccine-preventable disease will become a multiple case outbreak. House Bill 4425 and 4426 would undo progress Michigan has made toward increasing the number of vaccinated children in our state. So I must oppose the legislation and view it as a threat to public health. As a parent, I am fortunate that my 2 daughters are both healthy and able to be vaccinated. But when I moved to Michigan in June 2013, I had a 4-week-old baby, my oldest daughter, and she was too young to have yet received any immunizations. We moved to Washtenaw County during an outbreak of whooping cough. In that summer, there were over 100 cases in the county. Community immunity in Washtenaw County was not providing enough coverage for my baby at the time, and that threat was paralyzing to me as a mother because newborns who contract whooping cough suffer and can even die. That said, I think we do understand well the human health costs associated with contracting a life-threatening disease. So the ultimate thoughts I'd like the committee to consider is whether there are potential ripple effects from outbreaks. My family's solution to the low vaccination rates in Washtenaw County was ultimately to move, and we relocated to Kent County before our second child was born. If enough people make that choice and leave localities or even leave Michigan altogether, economies may suffer. I'd also ask that you consider whether, in the event of an outbreak, Michigan tourism would suffer. Measles outbreaks make national headlines. They're very dramatic. And how many people in our neighboring states may choose to go to Myrtle Beach or the Outer Banks instead of coming to our shorelines on Lake Michigan? Outbreaks are expensive on the individual level and affect families, especially mothers, who may need to take time off of work to care for sick children. And children may fall behind in school as a result of their time out during their illness. The committee should also remember that outbreaks are expensive in terms of real dollars and require the health department to spend money that may not be provided for in the budget. We have some power to prevent these occurrences by maintaining a high vaccination rate and preventing outbreaks. And because the current rules uphold choice while at the same time propping up public health, I urge the committee to oppose the bills and keep the rules we have.
Thank you, Kate. Any questions from anybody? Thank you, Kate.
Thank you.
Appreciate it. Mary Wisniewski wishes to speak, opposes the bill. Shane Bees wishes to speak, opposes the bill. Sarah Hernandez wishes to speak, opposes the bill. Leanne Stafford wishes to speak, opposes the bill.
Those can all get
These? That are there?
They're all colored.
All right. I guess if you're all here, Amy Zagman, Sharon Swindell,
Dr. Swindell had to return to
okay,
U of M.
Patricia,
Oh, she's,
oh,
Oh.
she said,
sorry about that.
Patricia Bednans,
I'm sorry.
Marta Johnson. All wish to speak, oppose the bill?
Marta Johnston, she had to return.
Okay, all right. It's all yours.
Great, thank you. Representative Kelly and members of the committee, thank you for returning this afternoon on this important issue. I am Amy Zagman. I'm the Executive Director of the Michigan Council for Maternal and Child Health. We are just one of the organizations of the Parent Information Network, PIN as we call ourselves, and I believe that you have information from us today and have received information prior. So there are a number of organizations. We tried to, in the nature of knowing there would be a lot of people, just bring up a few of the voices that are organizational members of the coalition. The coalition came together a few years ago, really around the issue that you heard of earlier today, the rising waiver immunization rate and the drop in fully immunized children in Michigan is of interest to all of our organizations. So we came together to support policies and look at potential solutions. So when the department came forward with the rules and really based those around the 10 counties that were already requiring in-person education really as a best practice, we were very supportive of that. We did follow that through the process that was mentioned with regard to the JCAR hearing. There was a hearing, and a number of us attended that in December of 2014 to put in comments in support. I would just say that there were multiple legal arguments put forth this morning, and I think probably folks are familiar that there have been a couple of court cases, none of which have found the rules to be unconstitutional. I also wanted to just point out that we've provided a variety of written information and are willing to meet with you at any time, so I don't want to take any more time. Dr. Swindell obviously has traveled to be here today, and Pat is here from Michigan Association of School Nurses, so I'll now let them speak. Dr. Swindell is the Assistant Professor of Pediatrics at the University of Michigan Health System and President-elect of the Michigan chapter of the American Academy of Pediatrics.
Thank you, Chairman Kelly and members of the committee for coming back and allowing more of us to speak on behalf of these bills. I am the president-elect right now of the Michigan chapter of the American Academy of Pediatrics, so in that role, I represent not just myself, but 1,200 or more pediatricians around the state. And I'll try to limit my remarks to things that either came up and weren't well explained or haven't been brought up as best I can, and I'm sorry if I repeat other things. But I think from the standpoint of a pediatrician, I just want to say up front that I believe vaccines are safe, effective, and saves lives, and that's what really drives my passion to advocate not only for patients of mine to decide to be immunized, but also to advocate for community vaccination at a broad level. I see how much parents love their children and how much anxiety comes in around a lot of the decisions they have to make about protecting their children, and vaccines is certainly one of them. And there's so much access to information now, and so many conflicting reports, some credible and some not, and that's really hard to sort out. I'm a parent. I've had to make these decisions too, so I really respect a parent's right to choose. I also really value the relationship we have with the local health department. We answer a lot of questions about vaccines, but we also don't have the time sometimes to do it in a non-rushed manner and to really, I think, give parents the time that they are due to really go over all these issues. So we really feel like we're in partnership with the local health departments, not that something's being taken away from us. And we also really rely on the local health departments when we have a child with a vaccine-preventable disease in order to prevent the spread of that infection. In our office, we have a lot we have to get together very quickly in terms of identifying who they may have been in contact with, who else might be susceptible, but we really need the health department's help on this too. I want to get back to the point of people who don't have a choice in the matter, because I think that's what it's getting down to. Broad vaccination of Michiganders is going to protect a lot of people that either choose not to be vaccinated or can't be vaccinated, either because they're medically fragile or because they're too young to have yet started the vaccine series. So I really come from a standpoint, if we can do anything to increase community vaccination rates while not taking away someone's right to choose, then that's what we're really doing this for. That's what I'm doing it for. I have a lot of medically fragile children, the kinds you've heard about, children with cancer, on chemotherapy, children who've had transplants. And I'm a general pediatrician. Every day we see newborns or children under 2 months of age that might live in households where an adult has cancer or a medical condition that weakens their immune system. So these are all the things I'm thinking about when I'm advising families. So in the end, I think the administrative rule was effective in decreasing vaccination rates, which translates to to decreasing the waiver rates, which translates to higher vaccination rates. So I feel like it would be a mistake to overturn that rule.
We have a question, if we could move on.
Yes.
Representative Crawford.
Thank you for being here. I have a question.
Sure.
This morning, there were a number of comments made about vaccinated children still getting the disease, and it seemed like it was a big problem, and I'd like to know your opinion about that.
Yeah, thank you for asking that, because I think that was one of the things that was unclear. So, first of all, not everyone who receives vaccine mounts the same level of immunity. I mean, this is the problem with medicine. It's not a black and white issue. Everyone's different, and their ability to respond to things is different. So some people who get vaccinated won't have the full protection from an illness. So I put them in a pool of people who then become protected by the community vaccination once again. Some people got a vaccine, but over time their protection waned and they became more susceptible to getting that vaccine, to that illness again. However, what we understand is that even if you don't become fully protected, in most cases, if you contract that infectious disease, you're often have a greater chance of having a milder case, and so there's still benefit.
I guess from your opinion and from the people that you see or the patients that you see, is this, how prevalent is this problem? With
I'm sorry.
children, yeah, with people who have been vaccinated actually getting a communicable disease?
Oh, boy. I'm not sure I can answer with a number. Have I personally seen a case of pertussis for a child who's been vaccinated? I'm sure I have. But I think the much bigger
Would you
problem-
consider it more rare, or I mean, more unusual, I guess?
Yes,
Yeah.
yes.
Okay. Thank you very much. I'm sorry, I didn't mean to interrupt.
No, no problem. I was just going to end by saying, really what it comes down to for me is that I think the rule increases protection of the community, and that helps those who don't have a choice or are more vulnerable, and it respects the right of those who can still choose. So, thank you.
Okay. Thank you also for coming back this afternoon, and I am so happy I have the opportunity to represent the Michigan Association of School Nurses. As school nurses, we work hard to promote the health of children, prevent disease and injury, and protect students from harm. Our goal is to have children in school healthy and ready to learn. We know that the impact of vaccines in reducing and eliminating vaccine-preventable diseases has been one of the 10 greatest public health achievements in the United States. I think it's important as stakeholders to understand our school environment. The clustering of children in the school setting provides opportunities for the transmission of infectious disease and the likelihood that an infection of 1 or 2 students will pose a risk for fellow classmates. New infectious diseases continue to evolve and emerge. It's critical to prevent the communicable diseases that we have the ability to prevent through vaccination. And just like everyone else has said, the vaccinated community helps protect those who can't be vaccinated. A school outbreak of a communicable disease also has costs that sometimes are not readily visible. And I think as school nurses, we see those costs. We have to remember that in Michigan, most of our schools do not have school nurses or healthcare resources to be able to respond to a communicable disease outbreak. And I think that's really important to remember, because what happens when you have a crisis like a communicable disease, you're pulling staff from the superintendent on down away from an already very, very busy day. It could involve extra custodial help. That's a cost that we've experienced when you're cleaning up, doing extra things. Extra secretarial help to help with communication. There are multiple collaborative meetings with health departments to get your plan ready on how you're going to act, also how you're going to communicate to stakeholders. Then you have to implement the plan, and then once you get everything under control, you go back and evaluate. All that takes time from that staff you're pulling from. Temporarily closing schools can also incur costs, as well as parent time off work. School nurses advocate for the health and safety of all students, and therefore do not support these bills that place Michigan children in harm's way by increasing their risk for communicable disease.
Thank you. Representative Brinks?
Thank you, Mr. Chair. Thank you to all three of you for being here and bringing your various perspectives. I am wondering, since this morning it seemed like there was a lot of questioning of the value of keeping an unimmunized child out of school, even if they have not shown that they are sick. And so can you talk about why we have policies that allow for that, and why that is of benefit when fighting the spread of a disease? Can you spell it out for us?
I think Pat should do that, but I also hope that the local public health officers that are here can speak to it.
And I'll let them also speak as well, but I think it gets back to that immunity, so that if you have children in school that are not vaccinated, then they are, of course, more vulnerable to that, and it just increases the spread of disease to those children, that whole group of children that are not vaccinated. I don't know if I'm explaining that. There's someone else that wants to. Thank you.
I think what was missing this morning, Representative Brinks, from my perspective that I've heard from other members, is it really protects those children who are unimmunized. They are most susceptible. I think Dr. Swindell's described it from a medical perspective, and Pat's described it from really an environmental perspective inside the school. But the children who are unimmunized are clearly at greatest risk. And depending on what the communicable disease is, some of these have major consequences.
And also then increase that rate for that school if you have more kids that are not vaccinated in that population. But I know there's someone else that may want to answer that as well.
Come up. And your name?
Jessie Kimbrough Marshall.
Jackie, did you have a card?
It's Jessie.
Or Jesse?
Yes.
Okay. Oh, there, Jesse
Sorry,
Marshall.
Jessie
Yeah,
Kimbrough Marshall.
there you go.
Okay.
Is it
Can
okay
you
to
answer
just
the question?
answer the question first? Yes. So your question was, why is there a concern about immunized children who are not vaccinated being excluded from school?
We heard other members ask that question repeatedly, and I feel like we did not have an opportunity to address it. So,
Okay. So when an unimmunized child is exposed to another individual who has a vaccine preventable disease, there is a time period where that unimmunized child who may be asymptomatic at the time has been inoculated with the disease, with the infection. And so we call that an inoculation period. If you take something like measles, there can be up to 21 days of being asymptomatic from the time of exposure, but yet being infected. And by the time symptoms would occur for an unimmunized child or any child, they have already been contagious. And so that's why, from a population standpoint, from a public health standpoint, it's so important for things like measles, which can be very catastrophic, particularly to vulnerable children, to make sure that we do infection control measures such as what we would call quarantine, and to have those immunized children excluded if they have been exposed.
Representative Hornberger?
Yes, thank you for coming back. I have a few questions. And the one to follow up, and I asked this earlier, can children that are immunized also contract a communicable disease that they've been immunized for?
So Dr. Eden Wells and, excuse me,
Dr. Swindell.
and Dr. Swindell both, I heard them give it the same answer, and I'm going to give it also. Yes, a child or any individual who has been immunized can contract a disease that they have been immunized due to reasons that Dr. Swindell explained about mounting an immune response. But what we do know is that oftentimes, if that individual, that child, acquires the disease from which they had received the vaccination from, the disease tends to be much milder in course.
Okay.
And that's important.
I guess my next question to follow up on that would be, will every child that's exposed, if there's a student in class that has the measles, will every child in that classroom end up with the measles?
So the answer is no, but from a public health standpoint, depending on what disease we're talking about, if we're talking about something like measles, we don't want to take that chance, because measles pertussis can be catastrophic to a vulnerable child.
So at that point, what we're deciding, if there's a student in class that has the measles and there are 30 kids in class and 10 have not been immunized and 20 have, we're deciding that the 20 children that have been immunized can stay in class and the 10 that have not need to leave. But we don't know if the 10 that have to leave and sit out of school for 21 days will ever contract that disease. And we don't know whether the 20 that are sitting there that have been immunized will ever contract that disease. So basically, in my opinion, as an educator and someone sitting here on the Ed Committee, is we're denying those 10 students the right to sit in that classroom just like everyone else and receive the same education as every other student in that classroom.
Right.
Because someone has made the decision that we think you're going to get the measles, even though we know there's a chance you're not going to.
So as I respect you as an educator and I respect you as an elected official, I, as a physician and also as a public health expert and a practicing physician, and also trained in pediatrics, I can tell you, just putting my healthcare hat on, there are some times where we're taking care of patients where we may not have the exact diagnosis, we may have only limited data, but because of science, because of evidence-based medicine, there are certain things that we do in place, like if someone presents with chest pain or someone presents with coughing and fever, there are certain things we do, even if we don't have all the data available, to make a most informed choice to help that individual. If we translate that into a population health perspective, we know things like herd immunity protects communities. We know that highly contagious vaccine preventable diseases, if measures are not put into place for control, infection control, catastrophic consequences can happen for certain individuals. This is the last thing I'll say because I'm hogging up the mic. I think one issue is that we at this time have benefited from the mass success of immunizations, and we have not, up until recently, seen a lot of issues with vaccine preventable diseases. I have colleagues who are in my age group, and I won't disclose my age, younger, maybe a little bit older, who have not seen measles, who have not seen certain other things, because vaccines have been so good at protecting us. And now that we're seeing increased rates of vaccine preventable diseases, we are now at a time where we're having to deal with the fallout from it. And I will dare say, from my professional experience, it will only get worse if we do not keep in place and improve measures for infection control.
So we also know, if we're going to extrapolate this out from the classroom, we also know that the majority of students in elementary school are involved in a myriad of activities beyond the classroom. So it seems absurd that we can just say that we're going to control this classroom environment when students are involved in all sorts of different activities after school. where they are exposed to, their parents choose to put them in activities, and they are exposed to all of these different germs and diseases, and if we're talking about communicable diseases and students that have immune deficiencies, you're also putting those students at risk. When scabies go around the school or lice goes around the school, the last thing you want to do to a child with a compromised immune system is put the stuff on their head that kills lice. But we put them at risk when we put them in a classroom and lice is going around the school.
Lice and scabies is not comparable to something.
I'm talking about the stuff that's used to treat it. If you have a student that has a compromised immunity, do you really want to put that on your child's head?
If I could just respond, I guess, to the first statement, all I'd like to say is, you know, it's not a black and white issue like much of medicine, and I agree with you on that, but it's a matter of risk. And so I think it's true you can contract vaccine-preventable disease after you've been vaccinated, but your risk is much lower. Whereas if you're completely unimmunized, the risk is much higher. So I think a lot of these decisions are based on risk level.
Representative Sowerby.
Thank you, Mr. Chairman. Thank you to the panel for your statements today. I want to focus on the issue of herd immunity. We know there is a risk population that either can't get vaccinated for age reasons or can't get vaccinated for health reasons. And if you could, through experience, could you speak to what you have seen out there in the real world of cases where, you know, the herd immunity issue has been compromised with the exposure to the various diseases that these vaccinations will prevent?
So I don't have numbers about herd immunity, and I do have an example to give you, but I want to get a disclaimer first. I think that we are just in the beginning stages of seeing a lot of these vaccine-preventable diseases rear their ugly head. And so I think the conversations we're having now will be quite different than, say, 5-10 years from now. With that being said, to touch upon your question, and I'm from Washtenaw County Public Health Department, last fall, we had a case of confirmed measles. It was chaos because this individual went to a place where there are hundreds of people, including children, working with the state, working with the Center for Disease Control. We had to, with limited data, we had to make a lot of decisions about infection control and informing the public. That also included contacting individuals who were on immunosuppressive medications, immune modulators, and also infants who were too young to get the vaccine. They were advised to, and I won't go into a lot of specifics, but they were advised to have special prophylactic therapy for their protection. Some of those individuals had some complications with the prophylactic therapy, which were standard medications. And so I give that example to say that herd immunity definitely has its benefit. We have, as a society, for the last several decades, have enjoyed the benefits of herd immunity. And now that we are getting into a time where vaccine-preventable diseases are starting to rear their ugly heads again, as we see rates of individuals declining vaccines, I think there's a lot more that we're in store for. I hope I somewhat answered your question.
You did. And following up on a brief comment you made earlier, and that was about the experience of these diseases in the public. I'm a baby boomer. I watched kids in my neighborhood suffer from polio, suffer from, you know, outbreaks of measles and all of these diseases. And then there's been this quiet period. The next generations didn't experience that so much because those vaccinations that many of them had gotten as children, you know, it had kind of wiped it out. We didn't see pertussis and we didn't see the measles. Now they're raising up. So could you expand on what your world is now seeing of these, let's say, X-generation, millennial parents who are now concerned about giving these vaccinations and their lack of experience themselves, maybe their parents went through these issues, but they haven't seen it. How is that affecting their view of not wanting to vaccinate their children?
Okay. And I am a parent also, I will say that. Now I don't want to speak for parents who, I don't want to speak on their behalf for parents who don't want to get vaccine for their children, but what I will say, and what I can comfortably say is, again, we as a society, we have benefited greatly from herd immunity and not having to deal with some very ugly vaccine preventable diseases like polio, like smallpox, like being able to safely say that measles was eradicated from the U.S. As of 2000, although we now know that there are cases that have been imported. And so what I would imagine is that a lot of us in society, whether you want to vaccinate or not, a lot of us in society, we have the benefit of being able to make decisions without knowing how bad things have been in the past.
And my last question, if I can, Mr. Chairman, one last question is, can one of you elaborate about the awful firestorm that Dr. Andrew Wakefield caused upon the medical community and the populations as a whole about his now debunked studies, but how that continues to resonate even through him continuing his speeches out there. Could you please just elaborate a little bit on that?
Oh, so I'll just say that, I was told as a young child, when an untruth gets told enough, there are enough people out there who will start believing it. And I think that just says a lot. I am also a clinical investigator. I participate in science and do research, and it is heartbreaking. It is heartbreaking that a fellow researcher would publish untrue things that is still affecting the masses. It is just definitely heartbreaking.
Representative Noble?
Oh, I think
Thank you, Mr. Chairman, and just as a,
you had another thing she was
oh, I'm
gonna
sorry?
add to.
Oh, I was just going to echo that I think the ripple effect from a very small study and the fear that it began continues to be seen this day. And although that was about a very specific association that's been debunked about vaccines, I think that general anxiety has spread to other things. And I think that's in the context of a generation where we really don't see these diseases as often. In my training, we didn't have two of the vaccines for meningitis that we have now, and my ICU rotations were almost exclusively with children with two kinds of bacterial meningitis, Hib and pneumococcus, many of whom died, many of whom had permanent brain damage, many of whom became deaf. Anyone who's seen what those diseases do really appreciates the fact that we don't see them anymore.
Representative Noble?
Yes, sir, thank you. Just thank you, staff, for coming and giving your information. You've given us a lot of information. I just would like to remind all the folks who are going to be speaking here in the future that we're talking about a bill, and I'm the sponsor of one of those bills, that is about parental choice. I appreciate the information, and I appreciate the ideas and all of the things we've been talking about, but I just want to ask you a simple question. Do you believe that parents are the primary determination on how to care for their children?
I think we do. I'm speaking on behalf of the coalition.
Okay,
We
thank
believe
you.
that the rules still allow for that.
And I would echo that, and that's how I started my testimony, is that I have great respect for parents' choice about their children.
Thank you.
One thing I would say, again, I am a parent, and so certainly I am in full support of parents having the right to make decisions for their children. There's just no question about it. But just again, putting on my doctor hat, there have been times in hospital settings, and I hope I'm not going off on a tangent here, but there have been times in hospital settings where there's been evidence-based things recommended, advised for, say, a child having some medical issue. And oftentimes, we've had to get ethics involved if the parent disagreed with that. That's not quite the same as what we're talking about here, but I just simply want to say that when we're talking about health care and then just extrapolating that into public health, it is not black and white. And I think we need to make sure that we understand these issues are not just straightforward, simple, we are tampering with a parent's choice. I want parents to have choice. If you don't want your child to have a vaccine, I just simply want you to be informed.
All right. Thank
I
you.
if I might, Ed, please don't send me a bill on this, doctor, but I would like your professional opinion. Can a child have a disease and not necessarily present in a school system and still be contagious? That's a question that I can't seem to get from folks.
Yes,
Okay.
as we have said before, if a child, whether that child is unimmunized or immunized, if that child is exposed, if that child did not say if is immune, has received the vaccine but did not mount a full immune response, or let's say that child is unimmunized and they're exposed to someone who has that particular vaccine preventable disease, that child, if they are inoculated with the disease, they can be asymptomatic, again, using measles, for up to
Right.
21 days, no symptoms whatsoever.
Yeah.
But by the time they start showing symptoms, they've already been infectious for 4 days or so.
So there's really no way to alert the parents of those kids that are not immunized. I mean, those kids could have been exposed for quite some time before that child is actually made aware that they've got to go home for 21 days. Is that correct?
Well, in public health, we generally, with local public health, usually someone with a vaccine preventable disease, it usually gets to our attention sooner or later. And as the moment it gets to our attention, we have evidence-based standardized protocols where we do investigations to find out who has been exposed, whether that's on an airplane, which that goes to the feds, or whether that's locally in a classroom, in a nursing home, or what have you. And so once we do that protocol and we find out who's been exposed, we contact those individuals, and that's when we put things into place.
Right.
Like exclusion from school if we deem that it is necessary for something like measles.
I guess my point being is that a child could be exposed long before they were ever required by the school to go home for those 21 days. Is that what you're saying?
No, that's not what I'm saying.
Well, but I think that's what I was asking. Is can a child come into a classroom and be asymptomatic but still be contagious to that class? Maybe they've got a couple of spots of measles on their chest or something like that.
Yes.
And nobody sees that.
Yes,
And they would be contagious at that particular time, right?
that's a
Okay.
possibility.
So then, 2 or 3 days later, when they actually pop up on their face, that child has been contagious for those several days.
Correct.
And we're seeing that child, now we recognize that child has measles.
Yes.
Right?
Yes.
Now we're going to tell those, using Representative Hornberger's example, those 10 students who have already been exposed for those 2 or 3 days or 4 days, you have to go home now for 21 days. Is that
So we
do I understand that
well,
correctly?
but we also in public health, working with pediatricians and practitioners, would also say that evidence shows us that if you take post-exposure prophylaxis, like if your immune system is okay, if you take, again, measles, the measles, mumps, rubella vaccine, that's going to give you some level of immunity and protection. If you have a compromised immune system, we would offer you immune globulin to help protect you and possibly get you back to school sooner, but most importantly, to help protect you.
But right now, the 21 days is what the rule says. You got to go home for 21 days. Is that correct?
For certain things, up to 21 days, yes.
Yeah. Okay. Thank you.
Quickly.
I was just going to say that's not always the case, right? The local public health officer makes that determination. Personally, as a parent, there's been multiple cases of chickenpox in our school district, and the unimmunized children are not
right.
excluded.
Ladies, thank you for your testimony today. We need to move on. Marianne Raymer, wishes to speak, opposes the bill. Marianne, we're going to get back to our 3 or 4 minutes here.
Good afternoon, and thank you all for coming back. My name's Mary Ann Raymer. I'm a survivor of meningitis and rubella. I'm a mother of 2 children who have had vaccine-preventable diseases that they have since developed vaccines to prevent. a grandmother of 2 fully vaccinated young boys. I'm a certified pediatric nurse at Beaumont Health. I'm a former public health nurse at Chippewa County Health Department. And this fall, I start my primary care pediatric nurse practitioner, doctorate of nursing practice at the University of Michigan. Go Blue. I speak to parents regularly about my firsthand experiences with now vaccine-preventable diseases when I urge them to reconsider refusal or vaccine spacing. I tell them about the fear I had as a parent watching my child lying limply in my arms, not reacting when they started her IV. I tell them about the recurrent pulmonary complications she's had since that time with exercise-induced asthma, sensitivity to dust, pollen, and smoke, and greater complications from upper respiratory infections. I tell them about having meningitis, how it was literally the worst pain I have ever felt, and I have delivered 4 children. I tell them it was only because I was moaning in pain in my sleep, and my husband took me to the hospital in time to prevent the worst complications. I have lost high-range hearing, and that is a lifelong complication that I deal with. Educated parents make informed choices, and the mandatory education has proven that with a 33% drop in unvaccinated waiver for children. We have never removed parental choice. We have only made sure it was an educated choice. We don't let 16-year-olds on the road without driver's education. So why would we let young parents make decisions that affect their child's lives without ensuring they're properly educated about this as well? Additionally, quarantining those who are at risk for spreading infectious diseases has been the mainstay of reducing the spread of those diseases since the study of virology began. To roll back those advances in medical knowledge has led to these recent outbreaks in measles and whooping cough that were once eradicated. We regulate the training and licensing of plumbers and electricians, licensing of gas station pumps, and operation of farmers markets, but we want to deregulate the authority of the health department to prevent a modern-day typhoid Mary from beginning the latest epidemic. To what end does that serve? I urge you all to vote no on House Bill 4425 and 4426. They don't promote healthy choices.
Thank you. Andrea Kloster wishes to speak, supports the bill. Wishing to speak, supporting the bill, Sylvia Rhodey. Wishing to speak, opposes the bill, Sarah Smith. Wishes to speak, opposes the bill, Ann Sness. Seuss, I'm sorry. Doctor? Dr. Seuss. There you go.
Hello.
Are you going to do it in rhyme?
No. It's a little harder to be taken seriously when I try that. It's hard enough with a name like mine. And I want to say that I didn't decide to testify today until I heard some of the earlier testimony this morning, so my testimony won't be as well prepared and as beautifully spoken as some of the folks I've heard preceding me. I did print out something quickly. I went home and printed this out. So Appendix E that you all have received, I want to show you this. In the column that says 20th century annual morbidity, these are the cases of each of these diseases that were happening annually just prior to a vaccine becoming available. So these are the pre-vaccination. Morbidity means illness. So these are how many cases. This does not report how many deaths. And then the most recent data that I could find quickly today and print up is the 2013 reported cases. So these were actual cases reported. There is one estimated disease at the bottom, Haemophilus influenzae. I won't ask you to learn how to pronounce it. It's not influenza. It's a different bacteria that causes very aggressive meningitis in children. The rest are actual case numbers. So I wanted to share that, and a mother who spoke earlier shortly ago said that she's not an expert in epidemiology, and I am. In addition to having gone to medical school, I also went to UC Berkeley School of Public Health. I have a master's in public health in epidemiology and biostatistics, so although this isn't, I didn't go into public health as a career, I went into medicine, but I am much more qualified than your average person to read and interpret data. And I want to emphasize that the research is very clear. The studies have shown very consistently, study after study, that vaccines are effective. And the best way to figure that out is not to go from one case report to another. I know a guy who had this, I know a mom who had this experience, but to look at these big numbers and look at the overall trends among cases. And so that's why I provided you with this. And so people have asked about the hypothetical case of what if a child has already been exposed, because as most of us know, a lot of illnesses are very contagious prior to any symptoms showing. You know, influenza is a great example of that. And so sometimes kids will be in a school spreading disease without knowing it until they show symptoms. And epidemics can spread like fires can spread. You want to catch it as quickly and early as you can before you have 15 kids in the school spreading the same disease, spreading measles or other very contagious diseases. So by taking those kids out who are most at risk, not who are guaranteed to get it, but the ones most at risk, sending them home during the incubation period for the illness, then you've cut down on that chance of an epidemic shooting through the school and the community like wildfire. I also want to mention that I'm a private pediatrician. I own a practice in Mason, Michigan. As a small town, small practice pediatrician, I love the current policy. I have talked till I'm blue in the face with many families about the importance of vaccinating their children, and there are some families who do not believe me, and they believe kind of their gut feeling and not the evidence that's so widely available. And so to have this backed up by the health department has been very helpful. It's saved me time, and it has also resulted in a number of families in my practice changing their minds. After going to the health department, receiving education, they made their parental choice to go ahead and vaccinate their kid. So I want to thank you for that. I know I'm running out of time.
Well, yeah, we need to move on.
But thank you very much.
Thank you, Doctor. Kelly Walensky wishes to speak, supports the bill. Hani Asadi wishes to speak, opposes the bill. Lynette Prentice wishes to speak, supports the bill. Mandy Ordaz wishes to speak, supports the bill. Mel Corrigan wishes to speak, supports the bill. Not did that one. Allison Lucas wishes to speak, supports the bill. Beth Bechtel wishes to speak, supports the bill. Hi, Beth.
Hi. I'm assuming the red light means it's on. Yes, my name's Beth Bechtel, and I'm from Hazlet, Michigan, and I'm a parent. And I'm really happy today that I heard from the doctors that vaccination does not equal being immune. We heard that there's some non-responders. We heard that vaccination wanes. So we don't know in the classroom when somebody is immune. Vaccination does not equal immunity. The other thing I wanted to say is earlier today, one of the representatives brought up immunocompromised. And it might have been a couple of representatives. To me as a parent, if I had an immunocompromised child, I would be concerned about the children in the classroom that were recently vaccinated with live virus vaccines, because we all know that they shed, and those children, to me, in kindergarten, we have lots of children that just received the MMR vaccine. So do we send home all the vaccinated children with MMR? Because they're shedding, and we may have another child in the room that is immunocompromised. So do we send home all the live virus vaccinated children home until the 21 days? And it's in the literature that live virus vaccines can shed anywhere from a couple of days up to a few weeks. And lastly, what I would like to say is we are not, as parents, getting true informed consent. It's not happening. We are getting one-sided information that is being provided by Big Pharma. And you know what? Us parents, many of us, we can read, and we can go read journals just like everybody else. And you know what? One thing that really bothers me that hasn't been discussed is we're talking about vaccine-preventable illnesses, and many of the people in this room, they've had them, that they've had measles, they've had rubella, they've had chickenpox, and they have lifelong immunity. But we're not talking about the children that have had chronic illnesses from vaccine injury. Vaccine injury is real. Vaccine injury is happening. We have 54% of our children in this country that are chronically ill with all kinds of things. And to me personally, I'd rather take chickenpox any day than a vaccine injury that lasts a lifetime. Thank you for your time.
Wishing to speak, opposes the bill, Christina Zilke. Washtenaw County Public Health.
Hi. Hello. I'm a parent of 2 boys. I'm a nurse. I vaccinate not only my own children, but others as well. I'm the immunization coordinator at Washtenaw County Public Health, and I work in the clinic giving vaccines and doing non-medical waivers. As a parent, I take my children to many appointments. I take them to the doctor, the dentist, the optometrist, and the orthodontist. Almost all of these appointments fall during the week, and I take time off from my job for them. It's a part of being a parent. It is a burden, and I use my sick time that I'm lucky to have. As a nurse at the local health department, I've done many waiver education sessions. I've spent as little as 15 minutes and as many as 90 minutes with a parent or family in these appointments. It all depends on the parent, their questions, their concerns. I'm not going to lie that some of these are very strained appointment times. There is a level of discomfort, a level of uncertainty that parents have. And as a nurse, when we first started doing these in 2015, I had that as well. I feel like now I'm kind of getting used to it. It goes pretty well. I know what to expect. But it still depends on the parent coming in. If the parent coming in is on guard and they're tense, you can tell that. We do our best to make them feel comfortable. But if the parent just has questions, some of them are repeat parents. We've seen them more than once. Those are pretty easy. We do a lot of education based on what the parent wants. So if they have questions about a certain ingredient, we can do that. If they have a question in general for anything, we have resources available to us. A lot of them don't have questions, but for people who don't have questions, we know they're not going to vaccinate, and that's okay. We talk to them about the signs and symptoms of disease to look for. We inform them of ways to prevent disease. For example, hepatitis B virus can live on a surface for up to a week outside of the body. HIV will die immediately outside of the body, but hepatitis B will live for up to a week. So we talk to them about teaching their children not to help people who are bleeding by touching their blood. My son had a bloody nose playing basketball, and his teammates handed him paper towels to help him stop his bloody nose. And what they did was take his old bloody paper towels from him. So we teach parents, teach your kids not to do that because that lowers their risk. We teach all sorts of different things, and it depends, again, on what the parent needs. Our nursing staff have received thank you notes. We've received cards, chocolates, hugs. We recently had someone in tears thanking the nurse who did her appointment because she expected to be treated poorly, and she wasn't. She was treated with respect and dignity, and she was thankful. I've had most of the parents that I talk to thank me when they leave. Many of them shake my hand. I've had a lot of them say, thank you for doing this. I'm glad that I had to come here and do this. I'm glad that you took the time to answer my questions. I have some other statements regarding the questions you guys had if you have another minute.
Representative Brinks?
Thank you, Mr. Chair, and thank you for being here. I am wondering, since you have done so many of these appointments with parents, can you talk to us about your interaction with parents for some of the different questions that they have had? For instance, in particular, I'm interested in knowing if you have a parent who has a religious objection and they start talking to you about that. Let's just say, for an example, maybe a conservative Christian who comes in and says they have some concerns due to their faith. How would you respond to that?
Usually when somebody comes in with a concern about religion, I ask them if they have a specific question regarding that or a specific vaccine, and if they want to talk about it. If they say no, then we don't talk about it. We go into the prevention, the signs and symptoms of disease, what to look for, how to protect their kids. If they do have questions, then I answer them as best I can. We have resources available for different religions, and so we can pull from that.
Is there ever a case where you just tell them they're wrong?
No.
Thank you.
You're welcome.
Ashley Grenslinger and Kelly Grenslinger, do you want to come up together? You wish to speak and support the bill?
Yes. Thank you for giving us the opportunity to speak. We, like one of the other speakers here, weren't prepared to provide comments. Oh, sorry. And I actually brought my daughter out of high school. She's a freshman, for an educational experience, and she and I elected to change the rest of our day to stay here and speak to you. So our statement may not be very eloquent, but we're passionate about what we have to say. So I'll turn it over to my daughter.
Hi. My name is Ashley Genslinger, and I'm 15 years old. I'm a ninth grader at Seaholm High School in Birmingham, Michigan. I am at the school. I'm in a lot of honors classes. I'm in honors biology, honors geometry, an honors social studies, and an honors English program. And I have worked very hard throughout my high school career, and I've sacrificed a lot in order to earn a 4.7 GPA on a 4.0 scale. I'm fully vaccinated except for boosters, and as many of you have heard, I can miss up to 21 days if another student gets sick at my school. And if that happened to me, my grades would be lowered, and it would not be good. If that happened to me, if I was told that I had to spend 3 weeks out of the classroom, I would be freaking out, because I know that my GPA could not be maintained if I was not in the classroom. I want to go into pre-med at the University of Michigan, like my mom, and there is like a calculator you can go on that tells you your chance of getting into a certain college. And with my GPA, I have a 67% chance of getting into the University of Michigan. But if my GPA was to go down by 1/10 of a point, my chance of getting into Michigan would drop by 8%. So missing school would cause my GPA to drop, which can further affect my entire life and my college and my career. Because missing school is also the equivalent of missing homework, missing lessons, tests, quizzes, assignments, and some of these things that I can do outside of school or make up after the 21 days, but a lot of them, such as lessons and lectures and participation, which is a huge part of my honors classes, those are irreplaceable, and I can't replicate them outside of the classroom. Missing lessons, I can't learn all of the curriculum in my classes, and if I don't learn everything, then it's impossible for me to do well on the tests. And so if I don't do well on tests and I can't turn in homework and things like that, then my GPA is going to drop, and we all know that then it's going to be much harder for me to get into a good college or go to the program I want to get into. Especially if this was to happen to me right now, which it very well could. It would be, since it's so late in the year, it would be really, really hard for me to get my GPA back up this late in the year because the year's almost over, so any damage that is done could not be fixed. And honestly, I'm really scared if I miss 21 days. It would be so detrimental to my life, and yeah.
So I'm not a doctor, I'm not a lawyer, I'm not a politician. I'm a mom, and I'm a business professional. And people who are smarter than me and educated in different ways today have talked about this rule that we're talking about relative to Bills 4425 and 4426. And they've talked about that it's an unfunded mandate. And they've talked about how it overreaches or conflicts with the law. They've talked about that the statute, not the rule itself, is least restrictive. They've talked about that we don't actually meet the criteria for informed consent. And I can't really speak much more to those topics, but I can speak to the piece related to education. And I think that as a mom, I get a little bit confused when I hear about what the Michigan Department of Health and Human Services has been saying relative to protecting the herd or protecting the population. So as a mom, I will receive notification from the classroom saying that there has been a lice outbreak or strep throat. And then I, as a mother, look at my child who's in that classroom and I say, are they well nourished? Have they been sleeping well lately? Are they healthy? And I then take that risk to send my child, and I weigh that risk against the risk of missing classwork, just as my daughter has explained. And so when you think about strep throat, I'm certain, it's extremely unfortunate, but I'm certain, and I don't have the statistics, that it's possible that people have died from strep throat, certainly have had discomfort and disease like some of these other things we're talking about. In the case of strep throat, the entire population is unvaccinated. Why, when we have strep throat, is the entire school not sent home for the incubation period? This is very confusing to me, and I think there's a lot more to this issue related to the lucrative business of vaccines. But that aside, we can all ponder that a little bit, but I'd just like to make 3 points, if I can, and I know that we've had some others take a long time, so I'll try to be brief, and thank you again for allowing us to speak. So the first is, I think we've established clearly that the unvaccinated as well as the vaccinated can catch, can carry, and be contagious when it comes to communicable disease. And therefore, keeping someone like my daughter, who's healthy, out of school isn't actually foolproof to prevent the rest of the classroom or grade or school from getting sick. And when you consider that leaving her out of school and potentially very seriously affecting her future, and when she tells you she sacrifices, she studies until 11 and 12 at night, she doesn't attend functions with her friends from time to time, she's extremely driven and committed. The idea scares both of us to our core that she would be asked to not attend school for 3 weeks, perhaps multiple times in a given year. When you think about that, her staying out of school when she's perfectly healthy, it actually doesn't protect anybody else. It's punitive to her, and she's healthy, and she represents a lot of children. And so I think finally the last point I'd like to make is that as a parent, I take very seriously my job to care for my children. I study, I read, I do have access to professionals. I've written a book. I've done a lot of things related to researching the health of my children, and I would very confidently argue that there's no one else on planet Earth that wants my children to be more healthy and more safe than I do. And I agonize over these decisions, and as my daughter said, we vaccinated for a while, and then my research taught me that there's risk involved with vaccine, and it's unknown to me, and I choose to not take that risk with my child. But that's my personal medical choice, just like it's my choice to send her to school if there's a student with strep throat. And I feel that if I have to come up with a decision to allow my daughter to pursue her education, which would cause me to be coerced into making medical choices for her that are not what I think are best. That's an impossible situation for a parent to be placed in. So all those other things we talked about, I care deeply about them and have opinions, but it's the denial of your right to education that has me sitting here today and taking time off work to speak to all of you. So thank you for considering our comments.
Thank you both. Thank you both for being here.
Thank you.
Was this educational for you today?
I think very much so, actually. Thank you.
Good.
Maybe she'll
Glad we
change.
delivered.
Yeah, she may change pre-med to politics. Who knows? Thank you.
Don't do it. Wishing to speak supports the bill, Dr. Kevin Odell.
Morning, or good
Yeah,
afternoon.
good afternoon, Doctor.
I too did not think I was going to speak, but I stayed the afternoon, so I still feel like it's morning, so forgive me. Dr. Kevin Odell, I am a physician in Oakland County, so I do support the bill. I know the waiver that we've had in place for, I guess 40 years now. As much as it was somewhat overreaching, it was fairly simple when the patient wants a waiver for their children to go to school, or any parent for their children, they fill it out. And it seemed very sufficient in regards to education for vaccines. But as a parent with 2 kids, and I do believe in light of the bills, I think the 2 main points is keeping kids at home or schools and health department being able to have that control or that choice versus the parents. And then the waiver rule. I, with 2 kids, if I put my kids through childcare and preschool, I have to attend 16 meetings at the health department. And I think that's certainly oversight. So year after year, I can go twice a year and get educated on why I should. It's certainly not really informed consent with vaccines. It is one-sided why we should vaccinate. And I can appreciate being educated and informed. Of the hundreds of people that were here earlier that could not speak, I know you're calling their names and many of them are left, many of them have vaccine-injured children, and those children too have to go, after they've been injured, back to the health department and be told to vaccinate their kids, even though they've been injured, and by those same vaccines they're being encouraged to do it again and again. And I think that's very negligent also. So I think I asked the committee if anybody for vaccine choice or personal choice regarding your children and healthcare matters. I think informed consent has always been a staple keystone issue. Making the right choice with conscience. If anybody in here has ever skipped a flu shot or has not had every booster, which probably nobody in this room has all their boosters, probably not a single person in here. So everybody in here has voiced a conscious objection, or has used a religious or personal belief exemption to not get a flu shot one year, or not get a booster shot for them or their children. So the young lady who just spoke, who had numerous vaccines, but not all of them, to be held out of school because she didn't get the last one of the 20th dose, is, again, I think far-reaching oversight. So they think these bills, to support them, would be a great step in keeping parental rights and balancing that with the issue of vaccination.
I was going to say Dr. Sowerby, Representative Sowerby.
Yes.
You called a lot of things, but not that. Thank you very much. Thank you, sir. I'm sorry, you said you were a physician?
Yes.
In Oakland County. What is your practice?
Doctor of chiropractic.
Okay, you're a chiropractor,
Yes.
not a physician.
Oh, no, I'm a physician.
My brother is a
Yeah.
chiropractor and
Excellent.
is not classified as a physician. My wife is a medical doctor and is classified as a physician. I appreciate your
No,
testimony.
that's all right. We're
It's important.
classified federally and at state level as, primary care physicians, licensed, regulated. That's okay.
No, that's not.
No, that is
Thank you.
true.
That's-
Primary care physicians, yes, we are. Licensed in every state, and we don't use medicine.
But I respect your profession as a
Sure.
chiropractor.
Oh, thank you.
You're not a physician.
Yes.
Thank you, Doctor.
That it? Okay, thank you.
Wishing to speak supports the bill, Rosalia Giannotti. That is our last ones that were wanting to speak. I will thank you for your patience. I'm going to sit here and read a couple hundred names into the record that both opposed and supported the bill. To my colleagues who don't need to listen to me read a bunch of names in, you're free to go. We will adjourn upon when we finish. So you can hang in there or not. And anyway, I want to thank you all for, again, your patience today And we'll see what we can do with this bill. So, thank you. These are, supports the bill, Mary Courts, Erica Phillips, Amelia Jones, Lynn Culver, Joanne Harper, Lindsay Harper, Malia Vachow, Jennifer Whitman, Amanda Holbert, Sandra Betton, Jeffrey Vachow, Jeanette Avery, Michael Plessman, Molly Rousseau, Mindy Vachow, Maria Myers, Debbie Kiki, Sally Geyer, Owen Stolarzik, Karen Keeley, Michael Demick, Sarah Demick, Connie Johnson, Denise Ritzema, Marcy Kaufman, Sean Jenkins, Kendra McCrimmon, Tiffany Metgen, Lindsay Markham, Allison Carlo, Kristen Lee, Tina Parker, Tracy Schnee, Polly Corbett, Nicole Pagan, Jeremy Kelly, Samantha Kelly, Natalie Schmaltz, Shelley DeLiesel, Shauna Lubinsky, Alina Miller, Kelly Ginslinger, we had that, Ashley Ginslinger had that. We had that. Jessica Gillisman, Elizabeth Mahoney Funk, Christina Odell, Shina Allen, I think we had Erica Closter, Alarni Stern, Jennifer Temple, Carol Moore, Wendy Scheifler, Rachel Middaw, Jessica Tobin, Robert Benko, Angela Benko, Tammy Schroeder, Teresa Holdrop, Teresa Eschweiler. The next list of names do oppose the bill. Catherine Haley, Melissa Tallman, Hope Raymer, Lawrence Rayner, Jeff Rayner, Florianne Bichet, Melissa Lee, Megan Schell, Kamalban Pernal, Brittany Plesher Kenworthy, Dr. Jessica Carney, Simeon Kmee, Christine Honer, Lindsay Huckabee, Kayla Barnes, Geeta Gupta, Amit Misra, Dr. Stephanie Grandal, Matthew Carter, Julie Creighton, Dr. Bella Justin, Monat Dejemi, Dr. Mark Zaffarani, Lauren Strady, Stephanie Vanderstelt, Reem Almamanzi, Dr. Jagrat Singh, Mohammed Hani Farhat, Shihu Kutswada, Mike Stifler, Ira Mala, Dr. Ala Alayan, Jasmine Verk, Dr. Gareth Kuhn, Sabrina Hugg, Joseph Fornoy, Kathy Howell, Scotty Patel, Michael Schmaltz, Rebecca Mastee, Nicole Paquin, Bob Kefchen, Christine Noner, Jerry Johnson, Annalisa Grunwald, Emily Laidlaw, Mary Pollock, Toby Lynn Moore, Colin Ford, Rachel Richards, Jennifer Smith, Mallory Reeder, Jill Sombers, Lisa Wegner, Lisa Hahn, Jara Semegi, Eric Lynn, Deirdre Wilson, Caroline Cashlow, Amy Kumbrecht, Heather Nickoff, Megan Swain, Mike Swain, Elizabeth Theno, Peter Spetafor, Dylan McGough, Megan Petsko Sweet, David Fowler, Jennifer Hamburg, Dr. Michael Anacker, Aaron Jones, Shannon Taut, Dr. Rebecca Lane, Gus Trem, Perry Camson, Denise Sloan, Chris Smith, Sean Gale, Elizabeth Cutlery, Christine Shearer, Kevin McKinney, Caroline Lytham, Lisa Haxnecht, Jennifer Hamburg, Dr. Michael Anaskar, Dr. Shannon Taut, we had that, Elizabeth Gross, Annie Lou, Ashley Cobb, Colleen Mathis, Dr. Rebecca Lane, Chris Mathis, Sam Nye, Dr. Sarah McLaughlin, Kayla Brodner, Lauren Wozniak, Julia Bennett, Rachel Smith, Andrew Jones, Dr. Razan Defala, Jonathan Gold, Brat Norat, Dr. Schwelz Rinson, Lola Abibo, Kristen Franz, Tim Hayberg, Dr. Manny Alice Renovay, Dr. Tamara LaRue, Dr. David Sinthorst, Dr. Lindsay Reynolds, Lauren Esvedo, Christy Lawrence, Mary McLeod. We do not need to, no absent members are here. Seeing no business before the committee. Can I adjourn?
Yeah, you're going to adjourn then.
Chair motions to adjourn.